Hi, everyone. Today I'm presenting the case of Staff Sergeant Danny Morales, a 33-year-old Army veteran referred through the Chapter 31 Vocational Rehabilitation Program through the VA. I'll go over his background, main challenges, and the plan we're putting in place to support a good civilian job fit. This is a pretty common scenario we see with combat veterans transitioning out of active duty and trying to transfer skills while navigating service-connected conditions and symptoms. Danny spent over 10 years as a wheeled vehicle mechanic in the Army. After a blast injury on his last deployment, he sustained a long term TBI with chronic symptoms and hearing loss. He wants to get back to work, but needs something that matches his abilities now. Like many veterans, his identity is deeply tied to his active duty job, so we want a career path that honors that. Danny has a chronic TBI that affects his memory, attention, and processing speed. He also has bilateral hearing loss and some PTSD symptoms like irritability and sleep problems. With all of these interacting, it makes loud, fast paced environments like a mechanic shop really hard for him. In his case, even regular noise levels can feel overwhelming after a few minutes, so we must explore a different job environment. Functionally, he struggles with multitasking, organizing new information, and staying focused when there's noise. He's also prone to headaches and reaches cognitive fatigue pretty quickly. Little things like someone interrupting him could potentially throw off his whole workflow. By using the ICF model, which looks at health and disability in a holistic way, focusing more on function and real life impact rather than diagnosis, it considers the person, their environment, and their goals, helping us manage cases like Danny more effectively and communicate better as a team. Bottom line is that he can work. It's just the right environment and pace needs to be there. We used ONET's military skills crosswalk to plug in his job code, then conducted a local job search with the National Labor Exchange. Because he has strong knowledge, we look for roles that use those skills but don't overwhelm his hearing or cognitive limits. We found an automotive service writer service advisor is a great match since it's quieter, more structured, and still lets him use his mechanic expertise. This lets him stay connected to the automotive field without the sensory overload. To support him, we're looking at updated hearing aids, possibly a captioned or amplified phone, and maybe speech to text tools for notes. On the low tech side, things like written reminders, checklists, and repeated instruction help a lot with memory and focus. He's very responsive to visual tools, so that's also a strength we can lean on. The accommodation Danny requires are straightforward: a quieter area for phone calls, written instructions to supplement verbal communication, reduced multitasking during complex tasks, and a brief breaks to manage headaches and cognitive fatigue. All of these align with ADA guidelines and are typically easier for employers to implement. They do not impede workflow. Rather, they support Danny in performing his essential job functions effectively and consistently. Sometimes just a few small adjustments can make a huge difference for someone living with TBI. Our Voc Rehab plan focuses on helping him adjust to his new normal, help build coping skills, and gets Danny comfortable advocating for his needs at work. We will collaborate with his employer and his VRN counselor at the VA to make sure the supports are working. The first few months on the job are usually the most important, so we'll monitor closely how everything is working out for him. We have other possible interventions as well if additional support is needed, like getting enrolled in the state's Career One Stop, the Jobs for Veterans State Grant Program through Workforce West Virginia, and other partner employment and or veteran resources to best provide the ultimate support for Danny. The letter to the employer explains his service-connected disabilities in simple language, lists the accommodations, and keeps everything collaborative, positive, and understandable. The goal is to make this transition smooth, not intimidating. A well-written letter can really set the tone for the whole working relationship for all parties involved. Danny brings a tremendous amount of skill, discipline, and experience to the table. His mechanical background is solid, and he has years of hands-on problem solving and leadership from his time in the Army. What he needs now is the right environment and right support so he can continue to use those strengths effectively. A role like service writer gives him the structured pace and communication style that best matches current needs while still honoring his expertise in the automotive field. When we pair that with recommended technology and accommodations, he's well positioned for a successful and sustainable transition into civilian employment. Danny served our country with commitment and integrity. Now it's our turn to serve him by ensuring he has access to the tools, supports, and opportunities he needs to thrive in the next chapter of his life. I'm happy to answer any questions or go over any part of the plan in more detail. Thank you.